Start with the vocab builder. Okay, just highlighting some of the key language that will be coming up later. Now, for the most part, I find when I take tutorials with students, we go through the reading, some practice work, practice resources together, and we look very carefully at sort of the step-by-step procedure and also how they are approaching the reading tasks. For the most part, I would say it normally boils down to correcting a student's technique, but occasionally it is due to maybe some language issues where the student has not got sufficient vocabulary, or there might be particular items in the reading that actually were blocking their comprehension. So some key words there. So we're talking about high frequency language, not the topical language normally. So we've got 5 items on the screen, and I'm going to put their definitions, and I'm going to give you 30 seconds to try and match up the words to their correct definitions. Okay, so I can see some of you have typed your answers into the chat box. That's great. If you're joining us for the first time, please feel free to type your answers directly into the chat box. And also, if you have questions, you're more than welcome to enter your questions in the chat box. I will do my best to answer them. But I would just ask if you can please keep your questions focused on what we are actually covering in the live class this morning, which is the reading. So yeah, as we're going through, if you have particular questions addressing what we're dealing with in the class, go ahead and put them in. And also at the end, if there's time, I will try and stay behind and sort of take a couple more questions as well. So let me just put the correct answers up on the screen so that you can check your answers alongside what I'm putting here. So basically, number 1, comprise is a verb to consist of or be made up of. Emergence, something becoming known or starting to exist. Transient, lasting for only a short time. And imperative, extremely important or urgent. And pandemic, of a disease existing in almost all of an area or group of people. So topical word there. And we will be having a fairly topical reading section coming up in part C today. So those are some important words that you're going to be coming across a little bit later. So again, we've got those words. If you could take them from the box in blue at the bottom and insert them into the sentences so you can see how they are used in context. Wonderful. Okay, so let me just check in the chat box, and I can see a lot of you have put your answers in. That's great. Okay, so let's put them up on the screen now, and you can confirm with me. So number 1, you may experience some transient episodes of uncontrolled pain. 2, intoxicated patients comprise 36% of all admissions overnight. 3, in some parts of the world, malaria is still considered pandemic. And 4, the medical community has seen the emergence of a new infectious disease. And the last one, it is imperative that the patient receives the antivenom within minutes of being bitten. So some key words there, and then put into contextual sentences, which is always a good way to record new language and memorize new words, to memorize them in semantic context. So reading part B, okay, we're going to be looking at the technique for that section. So let's just have a brief look at the overview here. So in reading part B, you get 6 short texts with 1 question per text. So each text, you're refocusing on a new topic. Part B texts are generally, they're short extracts from the following. So it could be from a notice, okay? So think about how you read these kinds of texts, basically. It could be from an email, manual, memo, guidelines, okay? So those are the type of places that you would find these kind of texts in your work. And then the 3-option multiple choice reading is for gist, main points, and detailed meaning. And I get asked sometimes what a memo is. It's actually short for memorandum. So it would be just a short message that's sent out saying memo, which means a reminder about something. Okay, so those are the kind of texts that you will find in this section, and this is the kind of reading that you're going to be doing. So gist is overview, main points, okay, the important points, and detailed meaning. It might be something very specific that you're asking, they're asking you to read for. So we need to pick that information up from the question type. Okay, so let me see if we have any questions so far. Okay, no, Mark is just commending everyone for doing so well in the vocab section. Excellent. Okay, so this is basically the step-by-step technique that I would like you to use in order to be systematic in how you approach this reading section. Always work on your accuracy first, and then you can work on speeding up according to the time that you need to simulate in terms of a test time sort of experience. So basically, you're going to read the question and the text first, and you need to be very clear when you're reading the question, what exactly am I reading for? So there's no point just reading the text and not knowing what the question is asking. Otherwise, you're just reading for the sake of reading. So you need to be very clear on what is the question asking me, pick out maybe the keywords in there, read the text, make a mental note of what you think the answer is. Then, this is important, you're going to read your answer options and make sure you read them all, okay? And then you're going to eliminate options that are clearly wrong because they will put distractor information in there. So just because you might find 1 or 2 words which match up with something in the text, you always need to go back and reference the question. You need to be very clear, I'm answering the question. I'm not sort of doing an approximate match here. I need to make sure that the answer I select is indeed the answer specifically to what the question is asking. And then finally, select your answer. So just checking the chat box. Okay, no, it's not about the reading. Okay, you're just messaging each other. That's absolutely fine. So those are the 4 steps. We're going to do a practice now, okay, put you through that. And I want you to really consciously make an effort to go through all 4 steps to arrive at the correct answer. So I'll pop out while you do that, and we'll go through all 4 sections of the technique. Okay, so I can see you're all putting your answers in. That's wonderful. We've got over 60 in the class now, which is fantastic. Oh, hello, Haimad from Switzerland. Welcome. My name is Mary Claire. Thank you for introducing yourself. So yeah, basically, I'm getting the answers going into the chat box, okay? And the first one, okay, is let's put it up on the screen here. Okay, we've got the highlighting going. So let's look at the question first of all. The guideline says that before going on a short break, what the nurse must do. So we're kind of looking at very specifically what the question is asking us. So before going on a short break, the nurse must do what? Let's have a look in the text here. It says basically there is a short break handover occurs between the nurse responsible for the patient and the nurse who is assuming responsibility for the patient. So in other words, that's the handover. This comprises of a short verbal handover focusing on the greatest risk for the patient and is essential. So essential is a strong word which kind of mirrors the meaning of must to uphold patient safety during this short break. So basically, the short verbal handover is going to match with option A, which is to speak to the colleague who will take over the care of the patient. So I think most of you got that answer correct. You put in A into the chat box, so well done. That's very, very clear. And keep a written record of who has agreed to look after the patient. That simply is not dealt with in the, so that can be excluded, eliminated, and ensure that the patient's documentation is up to date on the system. It doesn't deal with that either. So it very much focuses on the verbal. So it talks about documentation at the bottom of handover and transfer of professional care needs to be recorded on the electronic medical record. But you always need to go back to the question, and the question was asking specifically what the nurse must do before going on a short break, and that is dealt with at the beginning of the paragraph. Okay, so that's pretty straightforward. I don't think there are any questions so far. So let's just review the 4 steps, okay? Basically, read the question and the text. Be very clear when you're doing your reading. Highlight what's the key information in the question and make sure you are very specific on what the question is asking, and then do the reading of the paragraph or the text. Then you're going to look at all of your options, having made a decision as to what you think is the answer. Read all of them, eliminate the ones which are clearly either wrong, okay, not specific to the question, or maybe not even dealt with in the text possibly, and select your correct answer. So I can see some questions going into the chat box. Okay, will do. That was just the practice one. I'm going to be hiding the chat box, no problem, Shivani. I'm going to be doing that when we go on to the other practice questions. Okay, so it is a long break that should be recorded. Answer B. Okay. No, because the question was specifically asking about what to do, what must the nurse do before the short break. So again, you've always got to go back and be very specific on what the question is asking you. But thank you for putting your questions into the chat box. Okay. All right, cool. All right, so yes, we're going to move on now and do some 3 more practice questions for part B. Remember to use the 4-step method. I'm going to pop out while you do that. Best of luck, and I'll change the settings on the chat box. No problem. Okay, here we go. Okay, so just another 3 additional practice questions for part B. So let's go through and check the answers together. I'm just going to change the settings in the chat box, okay, so that you can now see each other's comments. Please feel free to communicate and put your questions into the chat box as we go through the answers. That's absolutely fine. Okay, so let's go to, first of all, question 2. So we have the answer highlighted on the screen, and you will see that we've highlighted in the question, you're reading for the purpose, okay? So you need to know that word purpose, the reason, okay? So what is the reason for writing the memo, which I said earlier is like a memorandum, is a reminder. So what is the purpose of the memo about surgical hand scrub? So you need to do our reading and figure out the answer for that. And so as we are, it says memo to all staff, surgical hand scrub. And basically it's got lots of information in there, but what we want to basically understand, why are they writing this memo? And they're writing the memo because there's something new, there's some new information that they need to make staff aware of, which is a revised optimal surgical hand scrub time of 3 minutes has been introduced. So this is new information that's being brought to the attention of the staff. And then it says this effectively reduces the time needed by 2 minutes across all specialties, including orthopedics. So they are basically, the purpose of writing this is to let them know there's been some new information has been introduced that they need to make the staff aware of. So that would match with inform staff of recent changes to procedures. So any questions with regards to number 2? All right, okay, no questions so far. So that was the purpose. Basically, they're just kind of, it's informing, but why are they writing the memo? To update, basically, staff on the new procedure. What does otherwise unchanged means? Okay, otherwise unchanged means, where is it? In which line is it? I'm just looking for it now. Thank you very much. Okay, just direct me to it. Last sentence. Okay, thank you. Yes, it says basically in that sentence, it says, has been introduced based on published research by both the Association of Peri-Operative Registered Nurses and the Centre for Disease Control. Although the protocol for surgical hand scrub, okay, it's all about surgical hand scrub, although the protocol is otherwise unchanged, comma, this effectively reduces the time needed by 2 minutes across all specialties, including orthopedics. So saying otherwise unchanged means apart from, because it says although the protocol is otherwise unchanged. So it means apart from the revised optimal surgical hand scrub time of 3 minutes. So apart from that, everything is unchanged, except for the new timing of how long to wash your hands for, basically. Is that clear? Okay, no problem. Right, moving on to number 3. This is about dealing with excessive summer heat. So never overlook the fact that if they've given you a title, that's also helpful information, letting you know what the text is generally about. So the notice about summer heat aims to. So what is the aim of this notice, basically, in regards to summer heat? So what is the aim? So basically, we've got lots of information that basically about what happens normally, but at the end it says it is therefore imperative. We had that word, I think, earlier, imperative, meaning very, very important. It is therefore imperative to discuss any such medications the patient may have in their possession or require, and or related queries with the attending doctor or pharmacist. So basically, this is something that they are bringing to the attention, okay, of staff, that they need to basically make, have this conversation with the attending doctor or pharmacist because of the implications of what excessive heat can do, I guess, to medications. Okay, so and then it says these drugs can greatly decrease the patient's ability to cope in hot weather by reducing the body's ability to perspire, etc. So I guess the effects of heat working together with the medications, in other words, contraindications, I would assume. So that would match with ensure that staff seek specialist advice when necessary. That matches to having that discussion with specialists, which would be the attending doctor or the pharmacist, So for patients taking medications in a situation where it is excessively hot. Any questions regarding number 3? Okay, I've got a question from Wilbert here. How long is it for each question? We say for part B, Wilbert, that you should be spending 1.5 minutes on that section. Okay, those 6 questions, try to get them down in 1.5 minutes. But like I said earlier, always work on your accuracy first. Make sure you're scoring sufficient number of correct answers, and then you can refine your timing through practice. Okay, why not A? Because this basically is not aiming to warn staff about what's going to happen with the weather. It's usual, okay? It says, as we approach the summer, the issue of excessive heat arises. So this is something that they're using it in the present simple, like it's a habitual thing that happens every summer. So this is not basically aiming to warn staff that they're having particularly hot weather coming. This is something which happens normally in the summertime. So we would eliminate A. Okay, no problem. All right, so I hope that's clear, Abdullah, that the getting hot in the summer is a normal occurrence. It's not something that happens exceptionally. They're talking about excessive heat. They're not talking about it being an exceptional occurrence. So you can see the difference there. Okay, right, moving on to number 4. The extract from the policy document, okay, aims to ensure that. So if we were to make that into a question, what does this policy document aim to ensure us about? And the title here is Pediatric Discharge, so you get a sense of what this text is about. So let's have a look. It says it aims to ensure something. So it is a policy of this hospital that upon their child's discharge home from the unit, all parents will receive written discharge advice. Okay, so that's something that happens. And after visit summary can be printed for the family along with any attendance certificates. Okay, and then highlighted at the bottom in blue, this is clearly set out. So that basically is referring back to the basically name of the consultant, diagnosis, medication plan, etc., which comes under the minimum data set. So it's clearly set out to avoid confusion of any kind. So that's where the aim is, okay? It's giving the reason of why this is done, okay? So basically, this policy document aims to ensure that the data set information of an after visit summary is clearly set out to avoid any confusion, and it will be printed for the family along with any attendance certificates. So that is the aim. Now, the appropriate software is used for discharges. That's not what this covers. And then the role of the clinician in discharge is clearly understood. No, that's not the purpose. It's clearly set out to avoid confusion in terms of the understanding when they are discharging the patient back to the family. So it's for clarification for the family. It's not clarifying the role of the clinician. It's basically giving them full information of the discharge arrangements which are listed in the text. So, any questions with regards to number 4? Yes, Anna's asking, is it okay to write on the test booklets to underline? Yes, it is, okay. Yeah, you can underline keywords in the question, and you can also underline on the test booklets as well, okay. You can write, so you write basically your answers in the answer booklet, and then you can underline on the test booklet. I'm not sure about highlighters. You need to check that, Raisa, on the OET official website, exactly what you can take into the test. I believe it is a specific kind of pencil. They do actually specify how dark the pencil must be. So yeah, basically check it on the OET website. I don't think highlighters, I think pencils and pens. Yeah, 2B. Thank you very much, Montserrat. Thank you. Oh, by the way, you've got your exam next week. That's excellent. So which test centre are you taking it in? Hopefully that will all go according to plan. That's great news that test centres are beginning to open. So those are our 3 practice questions for part B. We've got those 4 steps, okay?